Hello everyone, welcome back to Dr. Akhilesh-MedTalks. So today in this session, I just want to clear a few questions regarding hair transplantation. Let's say the first question is, what is hair transplantation? Generally the hair is taken from the donor site. So what is the donor site? Where is the donor site? Who is the donor? So these are the questions having by the general public. If the person who lost the hair, he himself is a donor, where is the site? This is just above the neck. This is called as nape of the neck, or else the hair will be taken from these areas. Why these are the areas chosen by the doctors? Here the hair is not easily lost. The hair stays for a long time from here. So these are the areas where the hair stays strong. So that's why these are chosen as hair graft donor sites. So the second question is, where is the hair transplantation indicated? Means who is suitable for hair transplantation? Let's say if person is having male pattern baldness, like if he is having history of an family baldness, or else a female is having a history of baldness, or else if anyone lost the eyebrows, or else if a person lost a hair due to any medications or any diffuse hair loss or any hair loss due to fungus, all kinds of hair loss, the people are suitable for this hair transplantation. So what is the techniques done for hair transplantation? Let's say we have only two techniques. One is strip method and second one is follicular unit extraction method. So these two are the techniques. Doctor will take out the hair, that is called donor hair graft. So in the strip method, doctor will take the hair along with the skin as well. But in follicular unit extraction method, doctor will only take the hair follicle itself. Okay, this is the difference. And the strip method is very cheap and economical for all the people. But the follicular extraction method, the follicular unit extraction method, it is very expensive, and only like the celebrities, other kind of rich people will go for this. The mostly used method is strip method. So and the fourth question is, so what is the sequel of hair transplantation? So what does it mean? Just after the hair transplantation, how the hair growth will takes. So this is the sequel. Just after the hair transplantation, after 2 to 3 weeks, whatever the transplanted hair, these will be fallen off, so fallen down. Please don't worry about it. That's the general thing, it happens after hair transplantation. Just after 2 to 3 weeks, all the transplanted hair at the last areas, this will be fallen off. When this hair will regrow, this hair will regrow after 2 to 3 months, and you're gonna get the satisfactory results after 6 to 9 months. For that time, you need to wait and watch, this is the patience, this is the trick. Patience, here the patience is the trick. Okay, so this is how the hair will be lost initially, but at 6 to 9 months you're gonna get the satisfactory results for hair transplantation. And the fifth question is, this procedure is painful or not? Yes, of course it is painful, but you don't feel pain, because the doctor will give you the general anesthesia or else the local anesthesia. Here the sixth question is, how many sessions do you need to attend? Here the answer is very simple. It depends on the area, how much they are covering. So how much area they are going to transplant. Okay, it depends. Maybe it's gonna take around 5 to 10 sessions, or else if you having the less area to be covered, it just takes 2 sessions or 3 sessions. It depends on the area to be covered. Now the seventh question is, how much time it takes for single session? It takes around 8 to 10 hours for a session. So eighth question is, what are the side effects of this hair transplantation? This is the most important question. Lots and lots of people having, and some people is having misconceptions about this side effects. The first misconception I would just want to clear is, you don't get any immune suppression. You don't get any immune suppression. Okay, this is the first misconception. The doctor don't suppress your immune system after your hair transplantation. Okay, this is the second doubt I just want to clear. And here the most common side effect is, if the operation theater where you are attending, that was not properly maintained, like let's say it was infected, it was not cleaned properly. Okay, so you're gonna get some kind of infection. Okay, this is the first side effect. Or else you're gonna get some kind of boils, let's say some kind of lumps or bumps on the red bumps on the head. So these are called boils. For that you just apply the hair the sorry you just apply the ice packs. So that's good enough. Okay, there is no permanent side effects for the hair transplantation. Please remember this. If anyone want to go for hair transplantation, please I suggest to go. Please don't stop by looking on the side effects. You don't have any permanent side effects. Remember this. You don't have any you don't think about any misconceptions like people thinks around you. Please, whenever you want to go, please go. The next question is how, like, what is the follow up required after the hair transplantation? Like, let's say when to visit the doctor again. So today I have done the hair transplantation. Let's say just after 3 days, let's say on the third day you need to visit the doctor again. Okay, and on that day he is going to wash your hair on the third day, and the next visit will be on the 15th day. On the 15th day he gonna give you some medicines. On the third day or on the 15th day you are going to visit the doctors on these 2 days. If you are regularly on the plasma therapy for the remaining hair, whatever was losing, like you already had the hair loss, right? For the remaining areas. So for that you will be on the plasma therapy. So for once in 6 weeks, you are going to attend for this plasma therapy. So this is how the follow up you need to make. So the next question is, this is most important question. Like people is having lots and lots of doubts. How early can I resume my work? After hair transplantation, like how many days I just need to take rest in the home? I don't go out of my home. It's just for 3 days. After hair transplantation, you just stay in home for 3 days and take full rest. After 3 days, you can go and resume your work. You know, that's very easy, just to stay for 3 days. Don't believe in any other misconceptions. You need to stay for 6 months in the home. Those things are not right. Just for 3 days. So, and the last question is, so what is the post surgery instructions you need to follow after hair transplantation? Okay, until 3 days after hair transplantation, if you go home, the doctor will give you saline spray. You need to spray once in 2 hours whatever the hair that was transplanted just by today, and you need to spray the saline spray, okay, for that hair transplanted hair once in 2 hours for 48 hours. For 2 days you need to spray that, and on the third day you need to visit the doctor. He is going to wash the hair, wash the hair, and after that, after 2 weeks from the hair transplantation, the doctor is going to start antibiotics, topical antibiotics. Means like let's say some creams will be applied. These are the topical antibiotics to prevent the bacterial infections, and he is going to give you painkillers if you have pain. So this is all the medications doctor will give you. More than that, the doctor will not prefer any other medications. So please be aware of misconceptions. No other medications will be preferred. Okay, please don't ask me how much is for a hair graft, single hair graft, how much the doctor will charge for single hair graft. You know, it depends on the consultants and who is going to do this hair transplantation. This is most important. You know, the cosmetic department doctors will be there on plastic surgeries. So these people will do the hair transplantation. But please trust the doctors. You're gonna see the better results in 6 to 9 months. Don't expect the best results just within 1 day or 2 days. It takes time. Okay. Please go ahead. Even if you have any critical illnesses, even if you are diabetic, or even if you are hypertensive, I would suggest please go for it. You don't have much complications. You know, this is like most of the people are attending for this hair transplantations nowadays. You know, they are staying well. No one is suffered with the any other critical illnesses because of this hair transplantation. So please, I suggest to go for it. So thank you once again for watching my videos, and thank you.